pinch a little spot to get a cut opening, right? And I try to stay in the middle. It doesn't have to be perfect, but I try to stay in the middle. And I cut up to about where the sternum stops, so you can feel where the sternum is. So I cut to about there. Notice how I'm keeping my scissors flat. And then I cut down to there, okay? So I got the abdomen open. And then I'm gonna cut flaps so that I can flap it, right? So the flaps, notice, if I did my diagram well, are more or less lined up with the top of the leg, right? So, and it's way easier to do this with scissors than it is to do it with a scalpel, right? So there's one side, and here's the other side. So, it's coagulated blood, right? So that's just, yeah.
Smeared it. Don't relate
it
to food.
Don't talk about corned beef hash. Anyway, don't ruin corned beef hash for me, right? So, yeah. So, so you can just, the reason I have a stack of paper towels, right, is you can wipe that stuff out. So after they die, you know, and they've been sitting for a little bit, the blood sort of leaks out of their arteries and stuff, and you know, you end up with brown crusties, right? So just wipe them out. One thing you do not want to do is rinse your cat. It might seem like a good idea to just rinse out all of that stuff, but if you rinse your cat, you're rinsing off the preservative too, and they will start to mold, okay? So if it's really gross in there and you want to clean them out, use the cat wetting solution. It's the spray bottle that's not the cleaner, it's the other spray bottle, right? And just give them a good spritz and then wipe it out with paper towels and then spray and then wipe and then spray and then wipe, okay? So this one's not too bad, right? So anyway, okay? So I'm doing my flaps on the bottom. Then I'm going to feel where my ribs are, right? And so my ribs stop, you can see them on this camera easily, right? So I'm going to just go right below, just because I don't, you know, I don't need to fight with the ribs, right? So I'm just following where the ribs are, right? Flap it open. If your cat is a fatty one, right? When you stick your hand up here, you're going to run into the diaphragm. That's the muscle that's responsible for breathing, okay? And so you'll run into the diaphragm. And so if you run your fingers towards the diaphragm with your palm facing up and then scrape the front of the body wall, you're going to get a little chunk of fat out, okay? If you've got a real fatty cat, it's going to be a big chunk. If you got a super skinny cat, it might not be much of anything at all. The benefit of doing that is it's easier to pull it out than to cut through it. So I usually just pull it out, right? Okay, and then I'm going to do the same thing that I did over here on this side, right? So I'm finding where my ribs are, and I'm just going to cut along the ribs, just because I don't want to cut into the ribs. Yeah? And then that flap is open, right? So our abdomen is completely open. Now, she's not laying flat the way we want to, but it doesn't really matter, right? So all of her guts are like slumped over to the side, but it doesn't really matter because she'll sort of flatten out as we go and it'll be fine, okay? Let's get her thorax open. So the tricky thing about the diaphragm is we don't want to destroy the diaphragm. We want to try to leave it as nice as possible, but we can't get into the thoracic cavity until we deal with it, right? Another tricky thing about the chest is that you got a sternum right there, and the sternum's bone. And it's kind of hard to cut through bone. It's not impossible, but it's a pain in the butt. So my recommendation is that instead of cutting directly through the center, you cut ever so slightly off center. It doesn't matter which side, right? But just a little bit to the side, okay? And so the way that I do it is, after I've opened up the abdomen completely, I'll go just to the side of the sternum, and I'll do like 1 or 2 snips until I can get my finger onto the other side of the diaphragm. So I'm going to show this to this half first, and then I'll show you guys, okay? So see how, right, I got my finger. So see how there's like a dome-shaped muscle right there? And I got my finger on the other side of it, right? So all I'm going to do is I'm just going to kind of use my finger, yeah, to hold the diaphragm, kind of pull it away from the body, and just cut right up against the body wall so the diaphragm lays flat, okay? So now let me try to show you guys, if I can, which is hard because I am not left-handed, but we'll try, okay? So you see how the diaphragm is like, it looks like a dead end, like a dome, okay? So what I'm gonna do is I just cut just enough so I can get my finger behind the diaphragm, and then I'm just cutting along where the diaphragm is attached to the body wall. All right, like that, because I'm trying to lay the diaphragm flat. So because I tried to cut it that way with my right hand, it ends up like sawtoothed, but anyway, right? Yeah? Okay, so lay your diaphragm flat. Only after you've basically cut the diaphragm away from the body wall on both sides can you then continue with opening up the thorax, okay? So then, and I'm going, and all that careful neck muscle dissection we did, we don't care about anymore. All right. Okay. So, and then the other thing that I'm doing is I'm just kind of, anything that's attached to the body wall, I'm just kind of pulling off of the body wall, okay? So the ribs are, you know, bones, and they're shaped like, breaking the ribs is to try to break the ribs as close to the back as possible, because if you break the ribs close to the front, then you have these sharp bone shards sticking out at you. And having experienced a sharp rib to the thumb, right? I got stabbed in the thumb one time when I was doing a demo, and it bled and bled. It was so disgusting, and it hurt like a son of a biscuit for like weeks. So try not to cut yourself on ribs, because it's just not, it's no bueno, right? So you see how I'm like trying to break them toward the back of the body?
Do they break easily?
Depends on the cat.
Yeah, I she's doing this, I would have never done that.
Right? So it depends on, this cat, they break them pretty easily. Some cats, they don't.
Like 5 pounds.
Sometimes, though, the small ones, they're real bendy. Right? So it kind of depends on the age of the cat and the musket. So this side, like, I can't get this side at all. Oh, wait, there we go. There's one. Okay, so it doesn't need to be, like, perfect, but there we go. Oh, there's a couple good ones. Okay? Yeah, so now her thoracic cavity is open. Okay? So let's go through parts, right? So we're just going to go through, we're going to start at the top of the list and just work our way down. So, right, the greater omentum is this layer of tissue that is mostly fat, right? So you can see that this is mostly fat. But there's like connective tissue in there as well. There's a little bit of epithelial tissue. And what the greater omentum does is it basically covers up all of the organs in the abdomen. It acts as energy storage, right? So it stores fat for energy, but it also kind of acts like a cushion on your belly, right? And so humans have these too. You never see them in pictures because they're unattractive. Right? So they never ever put them in pictures like in, you know, books and stuff, but it's there, okay? And so this is the greater omentum. And so it acts as a cushion, it stores energy. The other thing that it does is it also can kind of wrap around organs if they're damaged. So I had to kind of peel it off over here because it was attached to something, right? And what it was attached to is where her, wait a minute.
Is that coagulated?
This is all coagulated blood, but I'm trying to figure out if she's a she or a he. She's a she, but yeah, she's a she, but she's been spayed.
She's the messed up she.
So she doesn't have her uterus anymore. So what this was attached to is like the stump of where her ovary was, right? So because she had surgery, her greater omentum so the greater omentum can kind of like stick to injured areas and kind of like act almost like a bandage. Right? So that's what this is, okay? So don't take your greater omentum off, right? Just, you can fold it out of the way if you need to, okay? The greater omentum is called the greater omentum because it is attached, first of all, because it's big. Second of all, because it's attached, there is a lesser one. It's attached to the greater curvature of the stomach. So this big bag is the stomach, right? So the bag is going to be on your cat's left side, so that's the stomach. Notice that it's kind of shaped like my hand, if I do this. So there's a skinny piece that sticks up. That's called the pylorus. Yep, like my thumb. Okay, and then there's this larger piece that's like my fingers and my palm. Okay, so the stomach has two curves. It has an outer curve, which is called the greater curvature, and then it has an inner curve, right? Like inner curve, outer curve. So the greater omentum is attached to the greater curvature, right? So this is all greater omentum, this is all greater omentum, this is all greater omentum, this is all greater omentum. It's all one big thing, okay? The lesser omentum is attached to the lesser curvature. So this little thing that's like a little fatty thing instead of a giant fatty thing is the lesser omentum. Yeah? Because it's attached to that inner curve of the stomach. Okay? Other parts of the stomach. So we are going to find the esophagus again when we do blood vessels, but we're not going to do blood vessels today. So try to leave the blood vessels alone as much as you can. But you can feel at least the beginning part of the or the ending part of the esophagus. If you grab your stomach and go reach for the top of your stomach, you'll feel it feels like it's attached with like a really fat rubber band. That's the esophagus. Okay. The only other thing on the stomach that I want us to look at is I want to open up the stomach so we can look at the gastric rugae. So we're not going to open up any other part of the digestive system because it gets kind of a little gross as you get lower down. A little gross. So we're gonna just do the least gross option, right? And I'm just wiping out some of that dried blood, right? And so what I'm going to do is I'm going to cut a little opening. It doesn't have to be a big opening, a little opening in the stomach, okay? So I'm just going to cut along the edge here. Well, her stomach certainly is not very full. There's some stuff in it, but it's not super full. So if you're real squeamish, you don't want to look at this because it's not pretty. All right, so there's going to be like cat food, digested cat food in there. Right, and depending on what your cat has been eating or what they had been eating before they died. So there's fur balls in there sometimes. There's often, if they were eating well at the animal shelter, right, then there's food, right? So I don't know what that green stuff is. It's weird that it's green. Well, it's not grass because they can't digest grass, so the grass looks like grass.
Don't dogs eat grass to like...
Dogs and cats do, but, right, because they can't digest it, it helps them throw up, right, because their stomach gets full of goo that they can't puke up. So the whole reason I'm showing, and so what are some other things you might find in the stomach? If the cat has worms, right, sometimes you find roundworms in the stomach. I've found a lot of cats like to eat bugs, so I've found like beetles and stuff in cat stomachs. If the cat had long fur, oftentimes you'll find a hairball, right? So cats also can't digest hair, and they groom themselves, right, with their tongues that have those little, you know, yeah? They have rough spines, basically, right, on their tongues. And so when they groom themselves, right, it pulls out all the loosened old hairs that are falling out, and then they swallow them. Well, they can't digest the hair, so then they... but there's wrinkles inside the stomach called gastric rugae, and what they do is they allow for increased, so they sort of maximize surface area, right? And so hers are not obvious because her stomach is so stretched. So you guys look at another cat that has a little bit better looking stomach. She does not have much in here, right? I've also seen other bizarre things, like one time there was a purple hair tie. It's like the thumb of the stomach, it sticks up, okay? So that's the stomach, yeah? Moving on to the lesser omentum was this little thing right here.
Yeah, the thing that attaches to the...
Okay, so on to the small intestine. All right, so after the food starts digesting in the stomach, right, it continues to be digested, and also nutrients get absorbed in the small intestine, right? So the food travels from the stomach through the pylorus, which goes up, and then down from the pylorus, it goes into the first part of the small intestine, which is called the duodenum. So this is the pylorus that's going straight up, right? That's the stomach still, pylorus. And then it does like a, right, a total U-turn, right, down into the small intestine. And so the first piece is called the duodenum. And the duodenum is easy to identify because it's typically a lot straighter than the rest of the small intestine. The rest of the small intestine is all coiled up. But the duodenum, sometimes it has like one kink in it, like one little loopy bit, but it's fairly straight, right? So pylorus, duodenum, okay? Then it starts to get coily, okay? And the first half or so of the coily bits that I'm touching right now is the jejunum. And then right about now, I'm going to start calling it the ileum, right? It's all held together by this thin membrane that's called the mesentery, right? So that thin membrane is the mesentery. And so as far as you're concerned, there are histological differences between the duodenum, the jejunum, and the ileum. but as far as we're concerned, we're not going to look at those, the inside of them anyway. So I only expect that you are able to identify them based on their proximity to other things that are easy to identify, right? So you know this is the duodenum because it's straight. So this little piece of small intestine that's close to the duodenum is the jejunum, okay? Whereas this little piece of small intestine that is close to the large intestine, which is what I'm holding now, must be the ileum, okay? So that's how I expect you to be able to differentiate between the jejunum and the ileum, based on what they're near, okay? The large intestine is this thing that's kind of shaped like a question mark, okay? Why is it called the large intestine? Why is this called the small intestine? This is called the large intestine.
Relative size?
So diameter specifically, right? So the large intestine is wider, the small intestine is narrower. The small intestine is actually much longer, right? But it's much narrower, okay? The large intestine, so I'm gonna draw it in the cat goo. Sigmoid means S-shaped, okay? So that's what our large intestine or our colon is shaped like. In cats, it's more of a, well, actually, it's like, yeah, it's kind of like a question mark or a hook, right? So, yeah, so this is that. So it's got an ascending part, but it's not very long. It's got a transverse part. It's got a nice long descending part, and then it does this little like thing at the bottom.
Is it called sigmoid in the cat?
Mm-hmm. Right? So ascending, transverse, descending, and then sigmoid is at the very bottom. Okay, you can sometimes see it kind of does this little bend right there. That's the beginning of the sigmoid. Okay, so it's not as distinct in cats as it is in humans, but it's all right. Okay, between the ileum and the large intestine, there's this little thing that looks like an earlobe. Do you see that?
Yeah.
That's called the cecum. And the cecum is basically the beginning of the colon or the large intestine. It's like a little blind pouch that looks like an earlobe. Okay? Between the ileum and the cecum is a little valve called the ileocecal valve, because it's between the ileum and the cecum. You can't really see it, but you can feel it. You'll feel like a little hard nubbin right in there. I don't want you to cut it open. Just feel the hard nubbin. That's the ileocecal valve. Okay? And that's all the parts of the large intestine, yeah, or colon. Either name is fine, okay? Then we have the liver. So this was our diaphragm, right? So the diaphragm kind of sits right over top of your liver and your stomach, right? So the stomach is on the left side. The liver is kind of in the center or a little bit to the right, okay? And so the liver, the easiest way to tell the lobes of the liver is to start all the way on the cat's right side, right? So way over here, this is the right lateral lobe of the liver, okay? Now this cat, she's weird because she, normally, this has two parts to it. Hers does not. So normally, the right lateral lobe looks like two lobes. So don't be surprised if you see a cat where it looks like they have two, because that's more typical. This is less typical, okay? So right lateral lobe, right medial lobe, left medial lobe, left lateral lobe. Okay? So it's easy because the two in the middle are the medial ones. The two in the middle are the medial ones, the two on the outside are the lateral ones. Left side, right side. Yeah? Okay. The gallbladder, the location of the gallbladder varies quite a bit from one cat to another. On this one, hers is super obvious, right? So you see that little green pouch, right? It's green because bile has leaked out of it, right? And that's why it looks green. Some cats, it's not green. It just looks like a weird little pouchy thing, okay? Sometimes it's on the front of the liver. Sometimes it's like buried way under here. So the location of the gallbladder varies quite a bit, right? But this is a spectacular gallbladder right here, right? Okay, so the gallbladder stores and concentrates bile, right? And so it's near, it's kind of associated with the liver.
What does bile do?
Bile is a fat emulsifier, and so we'll talk, among other things, it breaks down fat. We'll talk about it a little bit more in lecture, okay? Pancreas. Okay, so the easiest way to find your pancreas, here's the pancreas tip, okay? Put everything back the way it was when you opened it. Take your greater omentum. Flip it so it's straight up, right? So you flipped it completely over, right? Your intestines are all here. And so do you see this kind of beige, nondescript thing. There's another piece of it right there next to the duodenum, right? So that's the duodenum. This whole thing is the pancreas. So the pancreas, depending on which side you're looking at, it either makes an L or a 7, depending on which side you're looking from. Exactly, right? So, yeah. So, yeah. So that's the pancreas, there and there. So it's next to the duodenum and underneath the stomach, right? Because my stomach is right here. But the only way you can get at it is if you flip the greater omentum over. Yeah? So pancreas, pancreas. Okay? Then we have the pancreas. You know one thing the pancreas does.
Insulin.
Insulin and glucagon. Yeah? Okay. Another thing that does it makes digestive enzymes. Okay? The spleen is this thing that's basically the color and the texture of the liver, but it's like lateral to the stomach. Yeah. This is pretty typical. They often, I find it kind of ironic that the spleen on cats kind of looks like a dog tongue. Right? So like if a dog's panting, yeah, it kind of looks like a dog tongue. So it's kind of skinny and long.
Do that again?
No, I'm not going to do that again. You have it on video. I'm not doing that again. Right? So, one show a day. Actually, 2. Right? So it kind of looks like a dog tongue, yeah? Okay. So that's the spleen. All right, now, we are, speaking of serous cavities, as we were this morning, right? Which serous cavity are my hands in right now? So not the membrane, but what the cavity is the peritoneal cavity, right? Right? Okay. So the visceral peritoneum is going to be where?
Inside.
It's underneath, ain't it?
The visceral peritoneum is going to be on the surface of the organs. Right? So I'm touching visceral peritoneum right now. Okay? Where's the parietal peritoneum going to be? Up against the body wall, right? So that clear shiny layer, so she's got a tear in hers right here. Yeah? But I can see it on this side. This clear. Sometimes I can pick it up and make a little air bubble. Yeah? So that's the parietal peritoneum. The visceral peritoneum is on the surface of the organs itself. Okay? All right. So that's the digestive. Let's do respiratory. So we already talked about the diaphragm, right? It's this dome-shaped guy. Okay? That's the muscle that's responsible for breathing. All right? Up in the neck, we've got the trachea. And you know it's the trachea. Do you see how you can see the rings in it?
Yeah.
It looks like a bendy straw, right? So that's the trachea. It's got cartilage rings that prop it open, okay? On either side of the heart, we're going to deal with the heart next time. So don't mess with your heart right now. Don't mess with any of the blood vessels, right? Yeah, it's not that big. Are the lungs. So each lung has 3 lobes in the cats. So 1, 2, 3. 1, 2, 3. Right? So each lung has 3 lobes. And because cats are quadrupedal instead of bipedal, we call those lobes the anterior, middle, and posterior lobe. Whereas in humans, we would say superior and inferior. We don't have. Right? We have 3 on the right side, and we have 2 lobes on the left. Because remember how your heart is doing that thing, right? So our left lung only has 2 lobes. Our right lung has 3, right? Cats, their heart is behaving itself and staying in the middle. It's not doing this thing. Right? So they have 3 lobes on each side. Theirs is a little more symmetrical. Okay? So anterior, middle, and posterior lobes of the lungs. Okay? The diaphragm we already did. Trachea we did. Okay, so which serous cavity am I in now? I'm in the pleural cavity. Yeah? And so where is the visceral pleura going to be? On the surface of the lungs themselves. So that shiny membrane. Yeah?
So anything that's shiny is basically going to be a membrane?
Pretty much. Pretty much. Right? And then where's the parietal pleura going to be?
On the lining of the body.
Right? Up against the body wall. So I'm grabbing it. I'm tearing it. Yeah? So that's the parietal pleura. Okay? And so we'll do the pericardium next time when we do the heart. All right? Urinary system. We're not going to do the urethra today. We're just going to deal with the kidneys and the urinary bladder. So, and the ureters. So there are 2 kidneys. There's a right and a left, right? Yep. And the kidneys are said to be retroperitoneal because retro means behind. And so your kidneys are behind the parietal peritoneum, which is kind of weird. So here's one kidney. Here's the other kidney, right? And so they're up against the body wall in the back. And so to look at the kidney itself, you've got to like dig it out, right? So what I'm pulling off some fat that's there for padding, but also what I'm pulling off is the parietal peritoneum, right? So that I can look at the kidney. The kidneys are often funny colors. They often show up as blue or red because they have a lot of blood vessels, and the right, when they injected the arteries and veins with latex, some of that latex ends up in the kidney, right? So that's why this one has little blue spots on it, because there's lots of blood vessels in the kidney. Okay, and so don't pull it off all the way or anything, but you know, just kind of so you can see where it is. And then what you'll notice, so I don't want to damage a bunch of blood vessels down here, so I'm not going to do too much exploration, but there is a kind of whitish pinkish little tube, right, attached to each kidney that goes down to the urinary bladder. So her urinary bladder is super constricted and tiny. Usually the urinary bladder appears larger, right? So this is her urinary bladder, and this thing is the ureter. So the ureter carries urine from each kidney down to the urinary bladder, right? And it goes through here, but I don't want you to dig it out because I don't want to disturb any blood vessels for now, okay? And then on the other side, we have another kidney with another ureter that I don't want you to hack at that goes down to the urinary bladder, okay? Starting today, we have now talked about 2 different types of bladders.
She doesn't have any adrenal gland?
They do have adrenal glands, but their adrenal glands are, they don't sit on top of their kidneys like ours do. They're kind of like buried in this goo, and they're not really obvious. So like this, see that like spot that's kind of brown in all the fat? That's the adrenal gland. They're there, but they're not as obvious and distinct. They're not like a little hat like ours are. They look like a little hat that sits on the kidney. These guys, it's like this brown nondescript thing, okay? So don't do both you don't have to dig out both kidneys, just do one. We'll deal with the urethra next time, okay? So what I was saying was we now know 2 bladders. So bladder is never the correct answer now. You need to tell me which bladder you mean. So if you mean this one, urinary bladder, the one that holds urine. If you are talking about the